G'day, Russell here from Adelaide West Physio and Pilates, and I wanted to talk a little bit about the McKenzie method today, also known as Mechanical Diagnosis and Therapy, or MDT, but most people know it as the McKenzie method, and how you can help people with not just spinal problems but extremity problems. And spinal problems are certainly the area that McKenzie has become well known for helping, starting off with low back problems and then neck and mid-back, thoracic spine problems. But in probably the last 20 years, the extremities have become something that it's been very evident that the McKenzie method, that approach of assessment and treatment, can be extremely beneficial for. I went to a weekend on looking at extremity problems, and just to clarify, extremity meaning arms and legs, so we're moving away from the spine now. How the McKenzie method can help extremity problems. And if you ask most physiotherapists who've had just, unless they're McKenzie therapists and they've gone through the training in recent times, they would probably question how on earth can that method help with a knee problem or a shoulder problem or an elbow problem or an ankle problem or a big toe problem or whatever. The way that, probably to explain it the best, is recalibrating what people think about the McKenzie method. So what it is it's less so about the treatment. A lot of people think McKenzie method, yeah, got it, it's going back into extension. It's much broader than that. In fact, it really starts from a few steps before that. It's all about how you assess the patient primarily. So it's a systematic way of assessing the person that's in front of you and looking at not just how they move and how they move in one repetition, but the key to MDT is looking at how they respond to often repeated movements. Does their movement change? Does their pain change with repeated movements in particular directions? Or sometimes it's sustained positioning, how their pain or their movement is affected by sustained positioning. And from that, coming up with a category, a classification, if you like. And I suppose the myth about the McKenzie method that needs to be addressed first is that there's only one category, and people are kind of pushed into that category. And that's not at all true. In fact, every person that comes through the door, you can categorize using the McKenzie method into one of the McKenzie categories or another category that's called other, that captures things that don't fit into those McKenzie classifications. And the other category includes fractures and trauma and persistent pain and things like that, whereas the first three categories that Robin McKenzie really distinguished are mechanical categories, how a problem behaves mechanically. So that's the first thing. The McKenzie method's not just back extensions, it's about assessing and categorizing patients according to how they present and how they move and how they respond to often repeated movements. So that's the first thing. So if you think of it like that, then it's not that much of a leap to think, well, in fact, the McKenzie method can be applied to extremity problems because you can assess them in just the same way. And the goal is to look at a problem in its entirety and see whether it fits into one of those categories. And one of the really, really, really critical things that I picked up from this weekend that I think is skated over much too easily by many, is that it's super duper important to screen the spine adequately. And there's a very interesting statistic about the number of lower limb problems. So there's a study that's going on at the moment with acronym EXPOS, which is extremities as a source of pain, extremity problems as a source of pain, where they're looking at large numbers of people over from many different areas, many different clinics, where they're looking at extremity problems and working out how many of those are actually a spinal problem masquerading as a limb problem. And for the lower limb, the figure was around the high 70s mark. I think it was 77% of problems that seem to be lower limb problems that are actually originating from the lumbar spine, with people that don't have any loss of movement in that area. Now, that's a pretty big number, and that's people without loss of movement. So it might be a little bit more obvious if someone walked in the door and they couldn't move in a particular direction, then you would think, oh, okay, the lumbar spine might be something that we need to explore a little bit further. But for people that have no movement loss, and yet when they're screened adequately, and that's the key, they've got to be screened adequately, that they can have their lumbar spine as a source of their hip or knee or ankle problem. And with the neck, the figure was around, I think it was 49%, so about half people who had a spinal source for their arm pain, whether a shoulder, elbow, wrist. So one of the real strengths of the McKenzie method is the way that you can systematically and thoroughly assess for a spinal cause for something. And if you're trying to differentiate between whether, if you've got a shoulder problem, then all the shoulder treatment in the world isn't going to make a big difference if the biggest component is related to something in your neck. I mean, that stands to reason. And to be able to screen really thoroughly for that neck problem is the key. So that's really one of the big strengths of the McKenzie method, and we saw evidence of that over and over again. Lots of different examples of people that had really surprising results, actually, of what we would have sworn was going to be. For example, one chap who came in who last year had quite a significant trauma to his foot, requiring down the track he required foot surgery, and he required tendon transfer, and it felt DVTs, and quite a long period of time immobilized, and had a loss of range of movement of his ankle, and had pain at his ankle, and affected his walking, and he wasn't able to run, and everything pointed towards the ankle. And yet, as part of the systematic, logical way of assessing that problem, the first thing that the group looked at was his lumbar spine, and lo and behold, to everyone's surprise, when that was screened and screened well, he was able to get up and run, and his range of movement improved, and his ankle pain went, and he was able to run. And in fact, when he left on Saturday, he just to test it out, he went for a run around the block. Hadn't been able to do that since the accident. And when there's a problem that's so clearly, obviously, seems to be obviously an ankle problem with that kind of history, it is really, really easy to go straight to that and not to check the lumbar spine. And yet that's really one of the big strengths of following the McKenzie paradigm, the McKenzie structure of assessing something, is before you do that, before you look at the ankle, you're going to screen the lumbar spine for any relevance as well. And he reported the following day when he was reassessed. So he was sent home with a specific exercise to do, was reassessed the next day, and he said he was 80% better. 80% better in 16 hours. We were all gobsmacked. And that was one chap. So there's a really obvious example of someone that had a spinal source for their problem, even though it would have been very, very easy to assume that he had an ankle component and anything in his spine was going to be secondary. So to me, the real strengths of the McKenzie method are the systematic way of looking at a problem. And the more that you do it and the more that you surround yourself with people that practice it, the better you get at doing that, really. And that's one of the reasons why Adelaide West, we've really embraced the McKenzie method wholeheartedly, and we all do training in it because we've seen the effects of it. I've seen the effects of it in patients that I've seen, and courses and demonstrations, and there's lots of clips on the internet as well. You can see lots of YouTube clips of people who have really stunning results from applying the MDT to the extremities. There's a great clip of someone on a course in the US somewhere who has a stunning result from, and I can't remember what their directional preference was, but really, really surprising stuff. So that's the first thing, is the amount of time that a relevant spinal problem is there, that if it isn't assessed for it, it's going to be missed. And then things are always going to be pretty slow and frustrating if there's something there that isn't being addressed correctly.